Hi, this is Dr. Gans again, and you're now viewing the fifth part in a six-part series on dental emergencies. In this video, we're going to talk about oral surgical emergencies. The first is, I just had an extraction and the area is bleeding. The second relates to unusual swellings in the mouth. And the third question relates to someone who's bitten their tongue or lip and it's bleeding. Now, what are the best things to do under each set of circumstances? Before we proceed, it's important for you to go back once again and review the disclaimer on video 1. Now, to answer this question about an extraction and the area is bleeding. Now, if you're bleeding for any reason from an extraction site, you need to call the dentist as soon as possible. While you're waiting, don't take any product that has aspirin in it. Aspirin is an anticoagulant and can exacerbate the problem. Now, if for some reason you're not able to call the dentist, then go to your kitchen and find a tea bag. Wet it, fold it, and place it on the extraction site. Tea has tannic acid, which is a mild coagulant and should help with the bleeding. Placing pressure on the site is also advisable and can be accomplished by rolling up several pieces of gauze into a tight ball. Place it on the extraction site and bite down hard on the gauze. If the bleeding persists, once again, you must call the dentist immediately. The type of bleeding we are talking about refers to post-extraction issues. Now, gums can bleed if periodontally they're not healthy. Although certainly requiring treatment, this should not be cause for alarm. If your gums do bleed, however, it's important for you to see your dentist. This can be the prelude to a significant problem and to other medical problems as well. Now, I found an unusual swelling in my mouth. Is this something to be concerned about? Now, there are many reasons for swellings to occur in the mouth. Some are cause of concern, others are not. If you have a large swelling in the middle of your palate, for example, or on both sides of the inside of your lower jaw, these may just be tori and are normal parts of your jaw's anatomy. You may just have noticed them for the first time. Other swellings, however, may be indicative of infection or some other process and requires a visit to the office. Make sure to give your dentist a call. And finally, I've bitten my tongue or lip and it's bleeding. What is the best thing to do? Well, first of all, when you're numb, there's always a chance that you'll bite your lip or your tongue. You can't even tell. So make sure you clean the area gently with a cloth and then apply a cold compress to reduce the possibility of swelling. If the swelling gets extensive or the bleeding doesn't stop, call your dentist immediately or go to a hospital emergency room for evaluation and treatment. This is not something to play with, especially the tongue. Tongues tend to swell quite rapidly and can cause a problem with the airway. So if this is occurring and you have any concerns whatsoever, please seek treatment immediately.